But now jumping to cactus, because it's a big topic, and also it's a very interesting topic. And also cactus in homeopathy in person, they are not as harmful and rigid and detached person as they are, because they have a very big reason why to do it. So you will understand this behavior. So the first word that I told that please remember, it was constrict. And I told that we will see this constriction in Cactaceae in homeopathy. So what does it mean, constriction in Cactaceae? Because one side, this constriction is appearing on the physical level. So they feel really constriction, congestion, or tightness, or a kind of choking sensation. And this feeling, this sensation is appearing in their head, the chest, and the throat. But the constriction is not just in their physical level, but also it's appearing on their mental level. And on the mental level, it's more pathological, because this constriction, it's a kind of constant feeling in a Cactaceae. Because they want to live their life, as I told you, in nature, but the life constricts me, they are feeling. Why? Because the life is taking away from me a lot of energy. I would like to give a lot of energy to do things, but if I'm giving, I will die. So it's a kind of constriction that I don't know how to live my life because the life is threatening my life. So they cannot be themselves, they cannot enjoy life because the abilities are constricted. But it's their delusion. So it's not true. This is what they are thinking, they are imagining. They think that if they let themselves to have pleasure in their life, they will suffer. They will not enjoy the pleasure as they want, because if I'm giving energy, putting energy into my pleasure, it will turn back on me and I will have lack of energy, so I will suffer. No one can hurt me. Means that no one can be close to me. So if I avoid keeping close to anyone to me, I will survive. So that's why I have to be independent. So they appear morose, dry person, but the reason is that I told you that if they attach to someone or something too much, they will suffer and they will be hurt. So they want to keep distance with everyone and everything. So most probably they will have no relationships, no kids, no dogs, no memories, nothing. But this not to suffer and avoid pleasure and fear of pain, it's also coming from a huge hypochondria. They are very hypochondriacal people. And it's not that they are running to doctors and they are pretending that today I have sore throat, tomorrow I will have cancer, after I don't know, I have arthritis or something like this. No, it's not an imagination. It's, of course, it's a delusion, but they are pretty sure about their sickness. And not just one sickness. So not one day cancer and another day, I don't know what other incurable disease. They have several sicknesses in the same time. So tons of. But as I told you, that most of the sickness that they are imagining they have in their delusion are incurable sickness. And what I told you, that they don't want to put energy in anything, because if they will lose their energy, they will die. So if they will go to see different doctors, do different examinations, it means them losing energy. So they have no time to waste to see different doctors, to try different treatments. What they will do, they will go to the pharmacy and say, okay, these are the drugs that I need to take, give it to me. Or they will go to the medical doctor and I say, listen, give me the prescription and goodbye. Because I know that which kind of drugs I need. Because if they take the drug, they will have an immediate help. They will not waste time. They will not waste energy. So let's see the 8 essentials of Cactaceae in summarization, in a short explanation, but now you know that what are behind all the sentences through this explanation. So the first, which is very important, and in every Cactaceae you have to see tightness and constriction. Second, avoidance of mental and physical suffering, and we know that why now. They are denying pleasure. We know why, wasting energy. So narcissism, being independent with desertification of relationships. Because if I will be close to, or someone will be close to me, I will suffer because that person will harm me with the love, with the split, with everything. Hypochondria, so searching for drug, not the doctors. Because if I'm searching different doctors, I'm losing energy, losing time, so I need an immediate drug.
So I want to underline a couple of things related to what Vicky told. And especially related to this first phase and second phase, because we do believe that this is really very important. Until I did not realize enough about this first phase and second phase, I was never able to prescribe anhelonium except when the patient was completely out of mind. Because if you study this remedy in every materia medica, you are seeing, and they are underlying, starting from Böricke to all the other authors, this audio-visive hallucination state. So this idea that a single note on a piano is surrounded by a halo of colors. And you understand that this is something that usually is true that many persons are out of mind, but usually not so out of mind. So to prescribe anhelonium with this symptom is really very hard. And for this reason, we are really, also yesterday we did a webinar with Turkey, and we were underlying again this thing of the first phase and second phase. And it's very difficult to find in the materia medica which is the first phase of anhelonium, because it was emphasized, especially this hallucinating part. Okay, of course, there is an hallucinating part because anhelonium is a drug. And of course, we are having symptoms related to a drug, and especially this painlessness of complaints, usually painful, that Vicky was underlying. It's something that they are sharing with other drugs, because it's very typical in opium too, but it's typical also in heroinum. So this is typical in drugs. Then, coming from Cactaceae, we can think that there is a different mechanism, but this is a typical drug symptom. But sometimes we are seeing the patient, we are seeing the patient in the first stage. And if we are not able to know that these people are really workaholic, we are never going to prescribe this remedy. So we do believe that we have really to reread the Materia Medica, thinking of these two different parts. Because as we were underlying yesterday evening, when you are reading a remedy, and in the Materia Medica, or in the proving, or in the repertory, you are seeing opposite symptoms, this does not mean that that remedy has two different kinds of personality. So there is not the Lycopodium A and Lycopodium B. There is not the sepia A and the sepia B. There is not the calcium carbonicum A and calcium carbonicum B. Lycopodium is just one remedy. There is not an open Lycopodium or a closed Lycopodium. So it's just that they are in a different stage of evolution. And so in the first phase, but it could be the second phase, for some remedies, the third phase, and so on. Because it's the evolution, and we want really to underline this. And it depends when we are seeing the patient. So we can see persons, patients, that if we are seeing them when they are 20 years old, and when we are seeing when they are 60, and they look like very different persons, this does not mean that are two different remedies. The remedy is there in the genes, so they are not changing the remedy. The remedy is the same, that as an evolution. So in other situations, it can be that we have to prescribe situational remedies, but this is not that they are changing the constitution. So this is something that we really do believe.